of the early stage professional ambassadors, and I'm pleased to be talking today with Toma and Shai from the Bonus Bio Group, who are going to be chatting to us about the MSc product. So one of the big reasons that I'm excited about the ISCT meeting this year is hearing the updates about how MSc products have been utilised in the fight against COVID-19. So I believe that, you know, that this is one of your key products now, but tell us a little bit about the background of this product and how you came to start treating patients with COVID-19.
Bonus Bio Group is an Israeli company that's active in the field of cell therapy and tissue engineering. What we're doing on a day-to-day basis, our bread and butter is growing live, active, viable tissue of bones. Actually, this is an example of what we're doing on a day-to-day basis. As you can see, it's a big piece of bone. It's a bone of the size of about 17 centimeters in length. And what we're doing on a day-to-day basis is take samples of cells from patients, isolate mesenchymal cells and other supporting cells, and grow patients a live new bone instead of the bone that have lost.
One of the key capabilities that we had predating the pandemic, which is very relevant to the development of Mesencure, our MSc product for COVID, is the ability to produce very large numbers of MSCs from adipose tissue to a level that is more than 3 times higher than what is produced today using commercial devices for isolation of MSCs from adipose tissue. This allows us to begin with a very large number of cells, which subsequently produces a huge number of doses, up to 45,000 drug product doses from a single donor cell bank without passing PDL 20, meaning without exceeding 20 population doublings, which guarantees that the potency of these cells is highly cells.
So what's your hypothesis on the mechanism of action? Do you think it's that they're acting as a secretory source of, I guess anti-inflammatory or modulatory proteins or contact? What's your sort of feel on how you believe these cells are acting in the context of COVID-19?
Okay, so we know that we don't want to make the cells more anti-inflammatory to begin with, because making MSCs more anti-inflammatory is very easy. You just put interferon gamma or TNF alpha and you make the cells secrete much more IDO and other anti-inflammatory factors, but you also make these cells less immune evasive. You make them more immunogenic, and hence they will be cleared much faster. What we wanted to do is strengthen the potential of these cells upon infusion to respond to the inflammatory stimuli of the body. And what we know that these cells are much stronger, both in respect to survival, viability, and in their ability to respond to these immune challenges. Another important aspect of the mode of action, which was very widely discussed during the last ISCT, is the safety, the hemocompatibility of MSCs. Now, we showed that our enhancement also reduces the expression of tissue factor of CD142 by 50%. By 50%, both at the mRNA, protein, and activity level. And we also show that we increase the expression of tissue factor pathway inhibitor by 2-fold. So we are getting a product that is not only more potent but safer, especially in coagulopathic COVID-19 patients.
So you're inducing expression or reducing expression?
We are reducing the expression of tissue factor, and we are inducing the expression of tissue factor pathway inhibitor.
Great, because some products claim to not have tissue factor on them, right? Some MEC products?
So they claim so. Yes, it's an interesting claim because we know that there is a wide variability in the expression of tissue factor between MSCs that originate from different tissues and even different donors. But I am aware of no conclusive finding that says that a certain kind of MSCs has zero expression of tissue factor. And since we are all biologists, I have learned that there is no such thing as zero anyway. So let's guess that there is tissue factor on MSCs, okay? MSCs by definition are pericytic cells that reside on the outside of blood vessels, which makes completely evolutionary and physiological sense that they will express tissue factor. The important thing is not to ignore it, is to address it head on and test it, and that's what we have done, and show that if you can have a procedure that reduces the expression of this tissue factor in all levels of the main dogma, right, as well as increase the expression of tissue factor pathway inhibitors, you get a product which is more hemocompatible. This was, of course, demonstrated also in preclinical safety studies and in a concluded phase 1 clinical study.
Now that's really fascinating, because I do recall this time last year as we went into ISCT Paris, I recall, there were presentations about how MSCs could help in COVID-19 treatment. And then a few months later, I was teaching to my postgraduate students about where we got to with that, and specifically because I have interest in adipose tissue myself and the mesenchymal stromal compartment, I was specifically looking for studies that were using adipose-based MSCs, and on the whole, I was finding, if I can remember, that it was mostly not from adipose. I think I found one study, and it was one of those studies that sort of the students looked at and sort of said, this has been, I wouldn't, go as far as saying it was rushed, but it was early results due to the early part of the pandemic. So it's really great to sort of see here we are a year on, and you guys have done that thing, the word that we all use here, and pivoted from one of your products into the space, into COVID, to see if you can advance treatment. So I greatly look forward to hearing more about your products in the future. And so I guess just to sort of summarize, how do you feel that this work that you're presenting here in the space you're in, how it's really contributing to building consensus, especially within a society like the ISCT, how it's sort of bringing consensus to the field of MECs?
I think that consensus can be only built with time and with more data. As you mentioned, I think we are adding a very important aspect and a very important brick to this wall due to our use of adipose MSCs, exactly as you said it.
It's been wonderful to meet you both and to hear about your amazing products, and I look forward to hearing more and more about where all the wonderful, the advancements in your trials would, in the future as well. So thank you so much for your time. And,
thank you, Anna.
and enjoy ISCT from the comfort of your home.
Hopefully next year we can meet in person. And
Absolutely. And I'd love to see some of this bone in person. It looks fascinating.
If the customs will let us bring
Absolutely, yeah.
wherever. If it's in Israel next year, no problem.